My name is Dr. Steve Gangemi. I'm a chiropractic physician in Chapel Hill, North Carolina. I've been in practice now for over 25 years, and I have a lot of experience with complementary sports medicine and holistic therapies that I've developed for the applied kinesiology world to help with patients dealing with a variety of ailments such as hormonal imbalances, digestive disturbances, immune system dysfunction, a lot of musculoskeletal problems. So I see a lot of young kids, even babies, uh, days or weeks old. I see a lot of different types of populations from weekend warriors to professional athletes and, people just trying to live healthier lives. I learned about applied kinesiology actually in high school when I was into triathlons and I started reading books by doctors like Phil Maffetone, his In Fitness and in Health book, and how he was improving athletic performance and improving injury conditions and helping athletes with injury prevention and endurance athletes with performing better through his nutritional and therapeutic techniques. And then further, learned that Dr. Wally Schmidt and Phil Maffetone were good friends. So while I was in undergrad at the University of Miami, first in the physical therapy department, and then seeing local chiropractors in that area, the one doctor had an applied kinesiology, the David Walther's Blue Book. So I started reading that on my own, sort of a side study, and then ended up going to chiropractic school where I just got involved with applied kinesiology. And although we couldn't have a club on the campus at that time and no classes during those years because it was forbidden in the early mid 1990s, I took all the applied kinesiology classes from the instructors who came down there, from people like John Bandy and David Walther, and obviously George Goodhart and Wally Schmidt and Bob Blake and many others. And quickly saw how applied kinesiology could get to the root of the problem like no other, and had a huge influence on the structural mechanical system too, which made me look deeper into just adjusting bones and looking at a subluxation complex without looking any deeper into something that might be causing it. So that really sparked my interest. And after that, I just pretty much was all into AK for the rest of my main focus at school and after that. AK is such an interesting tool because it's the only real time biofeedback evaluation that is available to a practitioner today, that is really available to anybody today, where you can actually evaluate, treat, and then see the response of that treatment to continue to reevaluate the person to see what changes you made, what changes you didn't make at that time, and how to better improve the physiology of that person's nervous system and their overall well-being. So where you see other types of therapies don't focus on that as much, or they have certain biofeedback or paradigms where they're looking at a certain aspect of how a person moves, or how maybe their metabolism works, or how maybe their digestion affects so many things of their body, or their immune system does. In applied kinesiology, we're able to figure out exactly what is causing what in that person and how it relates to their symptoms and how it relates to their poor health. And there's no other technique, there's no other protocols, there's no other biofeedback type treatment, evaluation and treatment uh, practice that is available to do that today. My topic at the international meeting in 2024 in France is on the link between the temporomandibular joint and dysglycemia, or basically poor blood sugar control and management. So I have identified a connection between the TMJ and blood sugar control. And what I'm going to show the participants, the attendees, how to evaluate this, how to know when your patient is having a problem with dysglycemia, and possibly getting symptoms such as TMJ dysfunction, tinnitus, vertigo, headaches, poor energy, maybe poor performance mentally and physically, and other symptoms of blood sugar imbalances, and how this is not typically apparent through the classic pancreas latissimus triceps link that we see in the applied kinesiology standard testing. That there's another way to test for this, another um, sort of protocol to use, another procedure to use, and how to go best about resolving this issue in your patients so they basically improve their overall health and well-being and resolve a lot of their symptoms that they might be getting related to this blood sugar imbalance affecting their temporomandibular joint. To a first time AK student or practitioner, I would say take as many classes as you can about applied kinesiology, learn from different doctors. Some you're going to agree with, some you're not going to agree with as much, but there's always something to learn from the different practitioners. Although many of us evaluate and treat differently, we all have the common theme that we're interested in using applied kinesiology to find the root cause of our patients' ailments, our patients' health concerns, and how to go best treat them in the most natural way. So don't ever pigeonhole yourself into thinking that your one professor or your one mentor has all the answers, but learn from others and see how what you can learn from the other doctors, the other speakers, you can use bits and pieces to further improve your knowledge and further improve your ability to help your patients and improve their health overall, and hopefully yours too.